Hi, my name is Kathleen Doe, and this summer I had the opportunity to intern at Stanford's School of Medicine, specifically in the CoSign Sleep Lab, also known as Computational Psychiatry, Neuroimaging, and Sleep Lab. My preceptors were Andrea Goldstein and Leah Harris. So, a little bit about me. I use she, her pronouns, and within this sleep lab, I focus on the TIRED study, which focuses on how improving sleep may help neuropsychiatric symptoms that are commonly present in individuals between the ages of 25 to 60 with depression and insomnia comorbid. This study utilizes high density EEG sleep recordings and neuroimaging. As a result, the research focuses on sleep in relations to health and well being. The college that I currently attend is Brown University as a junior. I'm majoring in biology on the biotechnology track as well as psychology. And what really made me interested in the health career is for my passion to help others improve patients' health, physically and mentally. I like to work knowing that my efforts are going towards a good cause. To give an overview of my project, my ultimate aim is to utilize signal processing techniques. This includes number 1, to estimate power spectral density of sleep EEG data to identify EEG channels and EEG epochs contaminated with noise. 2, estimate EEG activities of the identified bad channels. 3, remove identified noisy epochs. And 4, reconstruct the clean sleep EEG data. My major accomplishments include de-identification, manual identification of bad channels, channel interpolation, automatic removal of bad epochs, and measuring non-REM EEG power. So what does this all mean? So essentially, the sleep records that are recorded in the labs are very long, and manually inspecting sleep EEG data is really long and subjective, especially when we're recording from several electrode sites. As a result, this project focuses on spectral estimation to semi-automatically detect the noisy channels and noisy sleep epochs and remove them. And how does this relate back to the TIRED study? Essentially, this study tries to answer the question of how does sleep propensity changes after CBTI treatment. And so after CBTI, we're trying to see how SWA changes from baseline from post-treatment. SWA, also known as slow wave activity or delta activity, is a marker of sleep propensity. And this EEG power is between 0.5 and 4 Hz. So to give a background of my project, let's first look at polysomnography, also known as PSG. This is the golden standard for studying sleep patterns in both good sleepers and individuals with sleep disorders, in this case, insomnia. This includes several key measures. First, EMG, which is muscle activity, EOG, which is eye movement, and EEG, which records the electrical activity of the brain. In this project, I'm focusing on only EEG, which works by placing electrodes on the scalp to detect and record the brain's spontaneous electrical activities over time. As you can see on the pictures in the diagrams, you can see on the right side is what it looks like on an actual person with the electrodes on. And then the two images on the left are diagrams of where the electrodes are placed on the scalp. So this resulting data is displayed as waveforms that can be analyzed to identify different sleep stages and detect potential sleep disorders. Sleep stages are categorized with sleep scoring into non-rapid eye movement, non-REM, including N1, N2, and N3, and rapid eye movement, REM sleep, in epochs of 30 seconds overnight. Each stage is characterized by distinct brainwave patterns which help in understanding the quality and architecture of sleep. For example, N3 is known as slow sleep waves, which is marked by high amplitude, low frequency delta waves, while REM sleep shows low amplitude, mixed frequency waves along with rapid eye movements. EEG records not only capture EEG activities, but also physiological and non-physiological electrical activities not related to the brain activity, also known as noise. EEG data is composed of different frequency components that correspond to different brain activities during sleep. We've categorized them into 6 areas: gamma, beta, sigma, alpha, theta, and delta. Gamma being the most in frequency, as you can see on the left side, and delta being the least frequent. We also look into spectral density estimation, which provides information about the power distribution across different frequency bands in EEG signals. Ultimately, it gives us insights into the frequency composition of sleep EEG data and potentially added noise. So for my methods section, the presented data is part of the EEG data collected as part of a mechanistic clinical trial studying the changes in emotional regulation brain network following cognitive behavioral therapy for insomnia, also known as CBTI. Current data demonstrates pre-processing procedures and estimation of non-REM sleep power for 20 out of the 96 EEG records. So if you can look at the bottom of the figure, it's divided into 4 areas: screening, baseline, treatment, and post-treatment. So for screening, we look into the patient's consent, screening, and PSG screen for 7 days of sleep diaries and actigraphy. For baseline, we're looking at the overnight PSG before this treatment and doing lab assessments. Then we look into the actual treatment and providing the patient the treatment. And then lastly, we're doing post-treatment, which is another recording of the PSG overnight, and then another set of lab assessments. And ultimately, we are trying to see if there are any changes related to CBTI in the EEG activities. In order to remove noise from our EEG data, we first did data de-identification, which means any dates or PHI information were removed from any documents or files. Second, we did manual identification of bad channels. Each EEG channels were visibly inspected to identify and select bad channels. Channels exhibiting excessive noise or artifacts were marked for exclusion. Third, channel interpolation. For channels identified as bad, interpolation was performed to estimate electrical potentials in bad channels. This involves using EEG activities in other electrode sites. Fourth, automatic removal of bad epochs. An automatic algorithm was applied to identify and remove bad epochs. Epochs containing artifacts or noise beyond a predefined threshold was excluded from the analysis. This step ensured that not only high-quality data segments were retained for subsequent analysis. Fifth, measuring non-REM EEG power. Non-REM EEG power for delta, theta, alpha, sigma, beta, and gamma were calculated and demonstrated using totoplots to assess their relative contributions in spatial patterns during non-REM sleep. So what's the outcome? In Figure A, you can see an example of PSD from a patient, also known as a measure of quantifying EEG signals power across frequency, revealing brain rhythmic activity patterns. And so if you can see, there's 23 channels, and channels with high power at high frequency, which are caused by factors such as muscle activity, electrode artifacts, or external electrode interference, were defined as noisy. So noisy channels are the ones that are very differentiated. As you can see, the ones with very high power between 25 to 40. And then if you look at B, this is a sleep hypnogram, and it shows the patient's sleep in various stages from wakefulness to REM. And then in Figure C, this is a spectrogram at part of an electrode site called CZ. And this is an example of what a good channel looks like. So there's not a lot of noise, so that means it does not need cleaning. However, if you look at Figure C, this is a different electrode site called CP5, which highlights the noise within the raw data towards the end of the sleep. Notably, from 5 hours onward, the spectrogram shows noise that's inconsistent with prior data. So how do we remove the noise and what happens afterwards? So through my methods, you can see in Figure F that CP5s were interpolated and cleaned, and so this is what clean data looks like afterwards. And then you can see overall in the PSD, all the interpolated channels are all cleaned through the averages of all of the channels combined. And so this is the overall data and what the data should look like for further analysis. In conclusion, I was able to complete pre-processing for 20 EEG records for the TIRED study in CoSleep Lab using MATLAB. I was able to apply signal processing techniques such as estimating power spectral density and spectrogram for sleep EEG data, as well as identify EEG channels contaminated by noise. I was able to also use interpolation to estimate electrical activities in bad or noisy channels, as well as employ a thresholding technique to automatically remove noisy EEG epochs. Another thing that I did was measure power at all electrode sites across different frequency bands for 20 EEG records for non-REM sleep. Overall, having clean data is really crucial for reliable spectral analysis. Noise and artifacts in EEG records, such as those caused by muscle movements, eye movements, or external electrical interference, can distort the true signal and lead to inaccurate results. Thus, my efforts has helped the spectral estimation accurately reflect the brain activity, allowing for more precise analysis and interpretation. For the next steps, we will be completing more pre-processing for other records, as well as measuring non-REM EEG power for baseline and end-of-treatment sessions. And lastly, we would study the impact of CBTI treatments on non-REM EEG power. And that's the end of my presentation. I would like to thank all my preceptors as well as HCC as a whole for this opportunity.